David, can you tell me, there's some great news that you'd like to share?
Yeah, well, this week the province of Ontario announced that we're investing over $500 million into our 444 municipalities. Why, people ask? I mean, this builds on, we know our municipalities have been hit hard by COVID, as has all folks in the province of Ontario, but they deliver vital, critical services that people depend on in our community. And as we go back to a level of normalcy, get back to life as normal with the vaccine rollout, it's critical that we support them in that transition. We know that with limited vaccine supply, Canada is emerging to that light at the end of the tunnel, perhaps a little later than many of our industrialized G7 counterparts, but nonetheless there is light on the end of the tunnel, so we're supporting our municipalities. And why is that important now? It's important now because as we look at vaccine rollout and what that looks like locally, municipalities will be on the forefront, working closely with our public health unit, utilizing arenas, utilizing different measures to get vaccines in the arms of our community. We got a rural community, and we know it's going to be different in our 34 public health units. What's happening in downtown Toronto isn't the same as the challenges in Colborne, Hastings, Port Hope and Cobourg. So this added jolt, I mean, it's $3 million we're investing locally into Northumberland, Peterborough South, is going to be much needed support.
If you can you talk a little bit about the breakdown of it, if it's possible?
Yeah, absolutely. I mean, it's important. I'm good at memorizing, but you don't always have all the numbers, but I do in front of me. So it's $3 million in total. If you look to, County of Northumberland, $496,000, Port Hope, $135,000, Trent Hills, $132,000, Town of Cobourg, $172,000, and so on and so forth. We'll post it publicly so that everyone gets to see. And how that was determined was determined using two different measures. One, MPAC assessment of the households in every community, but also the COVID case count between January and today, what the sort of COVID case numbers are. And again, why people might ask, why are we doing that? Why are we doing it? It's important that we zero in on these metrics, data informed, to make sure that the monies are there so that those communities hit hardest and that have affected outbreaks. Some have been totally void of COVID outbreaks. Some have had that. So directing those funds to support with increased testing measures, to support, as I said, with the vaccine rollout, or, to help just deliver critical services, transit. Again, this is building on the transit announcement we made last week for additional transit funding, but it might be just roads and bridges too. Critical to recovery is going to be investing in our infrastructure, getting those new roads repaired, bridges repaired. And these are those things, again, best decided locally by your duly elected municipalities locally who manage all of those things. But we're working hand in hand because this is a Team Canada approach and we've got to work together to really get beyond. I'm looking beyond COVID. I'm looking to recovery. People are rightly feeling COVID fatigue. They want to return to life as normal. So I'm working hard with our municipalities, with our health units, with the feds on getting those vaccines in. Let's get back to life as normal. Because to be frank with you, we can't afford more lockdowns. This is detrimental to our mental health. This is detrimental to our economy. And we know we have technology with testing. We know we've got the vaccines coming in greater amounts. So together, let's get our life back and get back to normal.
Is it frustrating that you hear of a number of countries that have more vaccines at this point, and is it frustrating? Like it's frustrating to people to hear this. Is it just as frustrating to you to hear this?
Well, yeah, I think bottom line is we've had unique supply challenges relative to other countries. We've vaccinated 2% of our population. Israel's vaccinated 91+% of their population. Now everything's relative, but if you look again to most industrialized nations are far ahead of us. And how that affects the provinces, it affects us twofold. One, when we're investing thousands, hundreds of thousands of dollars to deep freezer units to store Pfizer vaccine. When we're told overnight, you're not getting any, you might get some 2 months from now. And we shift to Moderna. It's transported, it's stored differently. And then you have now the introduction of the AstraZeneca vaccine, which again is fridge stable, so that's also stored differently. So the idea that we have just one standard way of rolling out the vaccine is not the reality. The realities on the grounds are you have different vaccines the COVID vaccine by different manufacturers, I should say, stored at different temperatures. And the supply challenges that we've been hit with as a province really do affect us locally. It affects our health unit. It affects everyone on the front lines, our healthcare workers, who I would add have responded quite admirably in pivoting to the realities to make sure we get the jabs in arms as soon as they come. Net result, Ontario leads Canada in terms of second doses administered, in terms of setting daily records now, in terms of numbers of people vaccinated. We know we've got the capacity. We just need that supply. And it's not there. So, I mean, we could finger point, but Canadians, Ontarians don't want finger pointing. They just want to get it done. So we'll work closely with the feds. As I said, this funding that the government is providing, the government of Ontario, signals we're going to work with our municipalities, our Indigenous communities, our public health units, our healthcare providers to get jabs in arms and make sure we're supporting them.
Are we starting to see the light at the end of the tunnel?
I think so, yes. I think, I'm on the heels of a conversation with a tech solution for rapid testing, PCR testing. I start to see a year in, we've got to show lessons learned. We're talking technology solutions to protect workers, to make sure, a number of our manufacturers are testing their workers, rapid tests. You can go to the sites like at Canton Hospital to get tested to provide that peace of mind, those caring for their loved ones, essential caregivers. And with the vaccine, and it is positive. Let's for the rightly the questions, and look, I'll be straight, I have criticized. There's been just criticisms leveled at the federal government over their failure to provide supplies and the failed Chinese vaccine that they originally signed on to. But credit, is that they're bringing the supply in. These new vaccines that are getting Health Canada approval are coming in, and that's a good sign. And that they deserve credit for that. And we see now Q2, Q3, we're going to get more in, and Ontario's ready to get them administered.
Great news with this announcement, though, with the funding for municipalities for this. It's just one other step that we're headed in the right direction.
Yeah, I mean, provincially, my responsibility is over those areas that we have provincial responsibility over, and municipalities, when we're talking to mayors and CAOs and we're on a call about what do the logistics look like? How, it's not just how we're going to get jabs in arms, but it's how do people come in and out? How do we take a big space and reconvert it into a mass vaccination center? And the volunteers that are needed for that. So I've been on Zooms with Coburg Rotary, a leader, in terms of the Rotarians stepping up. They're always full of great ideas. With health unit, with our mayors, CAOs, staff, different departments. How do you vaccinate your works department, roads, our manufacturers, small business, retail? So these are all the realities that we're dealing with, very localized. How do you get into the rural communities, people who are receiving in-home care? And so everybody's working hard on the front lines. There's light at the end of the tunnel, and this funding helps us get there.
So much stuff going on behind the scenes that people don't see or don't hear about, but it's busy times.
Well, I appreciate you giving me the opportunity to sort of articulate that. And I know I've hit, anyone watching, you've hit us with a lot of info here, but I do think it's important. I mean, this isn't a 30 character tweet. This isn't a headline. This isn't a political headline. Like, people will read this article, but I hope this has explained why that money is important, where it's going to, and the myriad of issues we're dealing with from a public policy perspective to try and just support Ontarians, get over this COVID hump, get vaccines in arms, and get back to life as normal. That's what people want.